Drug Administration approved the first ever genetic treatment for a genetic condition. This treatment is known as voretigene neparvovec, or more commonly known as Luxturna. This is used in the treatment of a rare visual condition called Leber Congenital Amaurosis, or LCA for short. A study was published in The Lancet in 2017 which looked at the success of this treatment in children with LCA, thus causing Luxturna to become a hugely popular topic in the worldwide media. But what is this condition? What is this treatment? And is it safe or even effective? Will it change the world of medicine and surgery in the way in which we treat other conditions? Before we evaluate these questions by looking at the clinical trials on this treatment, let's take a look at the science on this topic.
Leber congenital amaurosis is a visual condition primarily affecting the retina, causing severe visual impairment starting in childhood. LCA is one of the most common causes of inherited blindness, and it's estimated that there are 100,000 people living with the condition currently. Common symptoms of Leber congenital amaurosis include photophobia, or pain when looking at light, nyctalopia, or poor vision at night, and various different signs of visual impairment. These include poor visual acuity, or blurriness, and reduced peripheral vision, which can progress into total blindness. Now, what's going on in this condition? Let's start by looking at the human eye. Rays of light enter the eye through the front lens and pass through various layers until it reaches the retina at the back. The main layers that we'll focus on are the retinal pigment epithelium in orange and the photoreceptor layer in yellow. This consists of rods and cones, which convert the rays of light into electrical signals to be processed by the brain. In LCA, these rods and cones become deteriorated, and thus light entering the eye cannot be completely processed. There is a particular gene, RPE65, which is highly expressed in the RPE layer of the eye. This is necessary for the functioning of the rods and cones in the retina. In a particular subtype of LCA, both copies of this gene are faulty, meaning that over time the photoreceptors can no longer function effectively, thus affecting the patient's ability to see. This is where the development of Luxturna comes in, which is the first treatment developed for LCA. Luxturna is a gene therapy treatment which combines a synthetic copy of the RPE65 gene with a viral vector, which is a modified version of the virus which can no longer cause disease. This is then formulated into a solution ready for injection into the eye. The patient is put to sleep under general anesthetic and receives an injection of this drug in each eye. Looking more closely at the retina, we can see that Luxturna is injected into the subretinal space. The working RPE65 gene is then taken up by cells in the RPE, and these can then produce the proteins required for the rods and cones in the photoreceptor layer to function. This surgical intervention slows down or prevents the deterioration of rods and cones, allowing the vision to be preserved.
So, now that we know a little bit more about how Luxturna works and the condition it aims to treat, let's see what the clinical research on this treatment is saying.
Let's go back to the important paper published in The Lancet. This was a phase 3 randomized clinical trial, meaning it was tested on a large group of people after the previous phase showed that the treatment is effective and safe enough to continue. Researchers assessed light sensitivity and dim vision, visual acuity, and visual fields before and after the treatment. This was a strong trial as it used the multi-luminance mobility test navigation courses to control the environment and used 7 different lux or lighting levels to emulate real-world efficacy of the treatment. As shown in the graphs, the green treatment group performed significantly better in the navigation test compared to the blue control and also had better visual acuity. The same trends were also seen when the visual fields were tested before and after treatments between the two groups. These promising results lasted the full 3 years of the trial, with follow-up results to be awaited. Now, what does the rest of the scientific field say? There are numerous studies which support the use of Luxturna in treating LCA. This phase 3 trial confirmed the results found in the original study, with the benefits lasting at least 4 years, adding an extra year to the minimum benefits of Luxturna. Additionally, Maguire and colleagues also found improved navigation, light sensitivity, and visual fields with Luxturna, with the effects lasting at least 3 to 4 years after intervention. A trial in 2013 looked at differences in visual function for patients receiving gene therapy for LCA in one eye only. As shown, the treated eyes had significantly better improvements in visual acuity. These diagrams on the right also show that the treated eyes had significantly better visual fields over time as the circles got bigger. Major drawbacks of the study were the extremely small sample size of 5 patients, as well as the lack of randomization, which could have introduced bias into the results. Finally, this recent study looked at the short-term anatomical benefits of Luxturna by analyzing optical coherence tomography scans, or OCT scans, which showed significant improvements in retinal structure. They also noted improvements in pupil campimetry, which is an objective measure of the eye's visual fields by looking at how much the pupils respond to light. Secondly, evidence suggests that subretinal Luxturna injection is safe with minimal side effects. Both of these aforementioned trials found that benefits of the procedure favorably outweigh the risks. Safety is consistent with vitrectomy, a common surgical eye procedure to reach the retina. The second trial observed no adverse or immune responses to the Luxturna drug itself. A 2020 review of the evidence further confirmed the safety aspects, as well as suggesting that intraoperative OCT scans can further improve the surgical outcomes. Finally, analysis shows that Luxturna is cost-effective when considering the improvement to patients' quality of life. This cost-effectiveness investigation used models to predict the prices of Luxturna treatment, and it found that not only would these patients have increased quality of life, but the models predicted that it would actually be cheaper than the traditional standard care. This economic evaluation came to the same conclusions and also modelled that Luxturna would be cheaper than other technologies for rare diseases which are considered to be cost-effective in the UK.
As you can see, there are a number of papers which support the use of Luxturna in the treatment of LCA. So let's take a look at the scientific evidence going against this treatment.
One of the main doubts towards Luxturna is how long the positive effects will last. This non-randomized trial looked at parameters of visual function to assess gene therapy efficacy in LCA. 9 out of 12 patients had very variable improvement after 2 years. This may be due to the majority of patients being adults in this trial, where there is more likely to be more significant retinal deterioration. This gene therapy trial, published in 2015, found only moderately and temporarily improved retinal sensitivity to light following the therapy in patients with LCA. The results peaked at 12 months and then subsequently declined to the point where 3 years post-intervention, only 2 of the 12 original patients had visual improvements greater than the pre-interventional levels. Finally, this report looked at 15 patients who all initially showed varying improvements in visual function following gene therapy. However, this decreased over time and the retinas of the patients continued to deteriorate, as you can see in these graphs. A major criticism of the field of genetic therapy is the possibility of severe adverse events occurring. This systematic review, conducting analysis of 149 clinical trials using gene therapy, focused on 38 which had the retina as the major target. Subretinal administration of gene therapy was the second highest for serious adverse events related to both administration and post-treatment. An example of adverse events in this topic area is the AT132 gene therapy trial for a muscular degenerative disease. Unfortunately, the 4th death has now been reported from a participant receiving this trial treatment. Gene therapy can be a dangerous field of medicine and surgery, and we must tread carefully. Finally, putting aside the benefits to the patient's quality of life, Luxturna is an objectively expensive treatment. Luxturna is the second most expensive gene and cell therapy currently approved in the USA at $425,000 per eye. This places a heavy financial burden on both patients and healthcare systems, especially if benefits are only short-term.
So, now we've looked at both the pros and the cons of using Luxturna in the treatment for LCA. Despite the doubts and poor history of clinical gene therapy trials in the past, the most recent and most robust clinical trials for Luxturna have showed promising evidence and currently indicate that it is a safe and effective treatment for patients with Leber Congenital Amaurosis. We must await the long-term follow-up results of these trials to be able to confidently say that there are benefits beyond 4 years post-intervention. However, the cost of preserving a child's vision and possibly preventing blindness is priceless, and so we must embrace all treatment opportunities and surgical innovations which may allow us to do so. What would you do if you or your child were offered this treatment?